Oh, we're live.
We are live again, Facebook family. I get such a joy coming here. I look forward to coming on Monday and Sunday nights when I hit my knees. I thank the good Lord that I'm going to be joining all of you. Once again, Pop Warren's here with his health and community tip for the week. I always say we give both of those a health tip because I want you to live a high quality of life and long life with your loved ones, and community tip, just good information for you and the community to know. And so I am excited because now this show is so popular. We have a pre-show to the show. I would have never thought that we'd be blessed like this here to give out all this good information. And I have here a very good friend of mine, Ms. Kathy Floyd, who is the Executive Director of the Georgia Council on Aging. And I have here Mr. Eric Jacobson, who's the Executive Director of the Georgia Council on Developmental Disabilities. As always, I have Dr. Nikita Pitts here, and I have the Executive Director, Ms. Susan Gallagher, affectionately known as what?
The
The lady
with the blue
Yes,
glasses.
I get so many people say, "Boy, you want to know something? She is really an enjoyable person." I said, "How do you know that?" She said, "Because you want to know something when the program's going on, even when she's not saying anything, she just looks so pleasant and she smiles." And I said, "You don't know Nora like I know her." No, I didn't say. I said, "You are exactly right. She is a very engaging person and very, 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 very." And in fact, let me tell you, when I say like that, the average person said, "Oh no," and I said, "Yeah, you're right. She's a very nice person." And what we're going to do now is, I am, as a senior, but you know, I speak to so many people in their 20s and their 30s who have grandmothers, grandfathers, papas, grandma, mamas that are really concerned about the senior population. And let me tell you, it could not be a better person to have on this show talking about seniors than Miss Kathy Floyd. And Kathy, would you let everybody know something about you? And then we can start talking about the meat and potatoes of issues that are very, very, very crucial for seniors in Georgia. So, Kathy?
Thanks again for letting me do this, do your show. What a great way to start the week off. What a positive, inspiring way to start the week off. I really appreciate it. I have been the executive director for 7 years now. I had my anniversary last week. Before that, I was for 19 years. So I have so enjoyed and felt so lucky to be able to spend a career working to improve the lives of Georgia's seniors. It has truly been a blessing.
We're going to give you a hand for that. Let's give her a hand. There we go. Thank you.
Well, thank you. I am here today mainly to promote. We have our Facebook Live event tomorrow morning, 10 o'clock to 11:30. The Council on Aging has for a number of years now sponsored Senior Week at the Georgia State Capitol. But of course, this year, we can't do that. We can't have hundreds of seniors descend on the Capitol the way they have. So we have put together a virtual event. We have collected messages from seniors all over the state. We have a program planned. We're very excited about it. It's going to be a mix of pre-recorded videos and live parts tomorrow. And I think if you tune in, you will definitely enjoy it. We have, I don't think anybody's going for more than 4 minutes at a time. We're going to be switching between all the different issues that we are working on this year. We are in the thick of things in the Georgia legislature right now. And so all of our issues are in play. I'm going to give you just a sneak peek at some information. I got some news, some good news Friday, that we have a real shot at getting some money in the budget for a new service for a behavioral health coach. And
that's awesome.
Yes. And this would be in low-income housing in Tifton and Albany, where there is a big, big need. And so it's not official, it's not in writing, so don't, you know, but we feel that we've got a real shot. We've got some legislators that are really, you know, really supportive for it. And so we're just very excited about that. It'll be a new service. And we knew it was important over a year ago to do this, but with the pandemic, even more important to get help for people, seniors dealing with issues and not getting the help that they need. So very excited about that. But we have a range of issues, and we'll talk about them all tomorrow on Facebook Live. I hope that folks will search us out, and you can go to our page, Georgia Council on Aging, and you know, if you go today, you can register. If you want to just tune in tomorrow, we'll be live starting at 10 o'clock. And one of the things we're going to have is we're going to have 3 different sections during that time where I do a live Q&A.
Oh, great.
Where our host is one of our council members. She is the executive director of Senior Citizens Inc. in Savannah, Patty Lyons. And Patty's going to be our live host, introducing each segment and going in between. And at different points during that time, we're going to have 3 different live Q&As. And so any question you want answered, you can put it in the chat, and we're going to take questions and get those answered during those live Q&A parts of the event. I think it's going to be you know, a fun event, a very informative session for seniors and seniors advocates to tune in and kind of see what's going on.
That sounds exciting, really exciting. And you know, my wife and I, we drive down, we look forward to, we come down the evening before the seniors gather, and we feel so very, very, very happy because we're walking among seniors and we see seniors in action for themselves. It's so empowering what you all do, because there's nothing like empowering individuals. And so, Kathy, I'm just so appreciative to even know you for all the years that you did for really. And I know you're very humble. I know I'm putting you on the spot, but yep. But I think that you need to give people flowers. And my military service taught me that. Lost a lot of friends. You need to give people flowers while they're here. They need to hear it. So even though you're a little uncomfortable, my spirit's just telling me to say thank you, thank you, thank you.
Thank you, thank you, Pops. Thanks for what you do, keeping folks in the Columbus area and all around informed. It's just great. Really is. We are excited. It's like I say, you know, very different than when we gather at the Capitol, but you'll be hearing from, I think we have 7, 8 different legislators that will be speaking to folks. Key leaders at the legislature talking about our issues, you know, urging seniors to reach out. You know, people are more likely to contact, you know, their member of Congress or U.S. Senator, or but these state legislators, you know, it doesn't take many people for them to sit up and listen.
Well, let me tell you something, Kathy, that's very important, because it is a difference. And they are happy to come out of session and to speak with you. Yes. And so it's a very vital, and I try to tell a lot of seniors, and fortunately enough, Katie, and she's a workhorse. She will make sure that there's transportation for any seniors that want to get there. And I've heard from so many that it's so delightful to go there, to be among other seniors, and then to really talk to your legislative delegation is awesome. And so I'm glad that with all the things that you have going on, that you figured a way to have us do that virtually. And now, so I cannot wait till tomorrow to get on. Now, I know that there are a lot of issues that individuals need to know, seniors need to know, and loved ones of seniors need to know that you're trying to have to get the attention of our legislators? And what are those issues that they
Well,
are?
the other budget issue is, and this is always number one for us, is home and community-based
Yes.
services. All of those things that keep our seniors and anybody that's my age, our age, pops, we want to be independent as long as possible. We want to have those things that can keep us at home as long as possible, or in the community as long as possible,
Right.
and out of a nursing home. Nursing homes are needed, but you don't need to be there until you have to be there. And so there's a whole range of things that can keep us independent. And we advocate for funds for those services all across the state. I know Katie Howard has a waiting list
Yes.
for folks for those services. We have over 7,600 people on a waiting list across the state of Georgia for
And
those
Kathy,
services. And so,
can I just interrupt you, because a lot of people, when you say that, and this is one of the biggest things that we look for, funding for home and community-based services. Could you elaborate on that? And I'd like to make a comment. When May was sick, my wife was sick for months. And you're right. It's a reality check because that's the one thing we do want to maintain is our independence. Yes, do our children love us? Yes, they do. And I don't know how many times they say, you can stay with us and we'll take care. Why? But they don't have the sense that is very real to us that we want to have our independence.
yes.
But also at the same time, when we had a daughter come, personal things, shampooing your hair, bathing yourself, little things, having someone come in to tidy up your room, things like that that are so vital to maintain independence, even, by the way, help you take your medications.
Yes.
And which is very important. These things that we as seniors, we hold on to because it helps us maintain our independence,
yes.
because that's very vital to us. But that's what the home and community-based services do, help us with activities of daily living.
Exactly.
And Katie helped me because I had a difficult time with my injuries, even putting my socks on. She said, Pops, we have assistive devices to do that. Now, instead of it taking about 30 or 35 minutes, zip, I put it on that little contraption and pull it up and I'm good to go. But little things like that that you overlook. But the sense of independence, Kathy, is very real when you get to be our age. And so the home and community-based services for our viewing audience is very vital to having seniors stay in their own. Do our children love us? Yes. Do they want us to come and live in their homes? Yes, and we love that, but we want to stay in our own homes as long as possible.
Exactly, exactly. And that with, of course, the behavioral health coach that I talked about. And for our legislative issues, we are working to require that whenever a death occurs in a nursing home, that the coroner, the local coroner, be notified. The coroner throughout Georgia, they are notified when a death occurs in 10 different instances in Georgia. For instance, when a child dies, when there's a suicide, when there's suspected murder. We want to add an 11th time, and that's in a nursing home. Currently in assisted living, in personal care homes, you have to call the coroner. But in a nursing home, you don't. The nursing home itself determines what the cause of death is. And if they rule it's a natural death, they do not have to call the coroner. And we've had coroners bring this to us actually the third time that we've been working on this in the last 18 years. And it's because coroners find out from families that they're suspecting abuse and it's very late to actually do any investigating. And if a coroner could be called, what we hear from coroners is they can make a phone call and with some key questions find out whether they need to come out and investigate or not. The legislation that we are working on would give them 3 hours to return that phone call. And if the nursing home doesn't hear from them in 3 hours, they go along with what they were going to do anyway. So this is giving a 3-hour window to have another set of eyes determine, is that a real natural death or not? I tell you, we have some pictures of people who died in nursing homes and it was termed a natural death. And you can tell from these horrifying pictures that this was not a natural death. And so this is something that we're working with legislators on. We don't have a bill number yet, but we are trying to see if we can get some support and put this forward to just have another set of eyes whenever a senior passes in a nursing home. A very, very important issue. And like I say, a group of coroners has brought this to us. They're seeking this, to be added to their, to their duties.
And so it's really significant then, Kathy, that the coroners have approached you. So that tells you something like this here is something that needs to be pursued. And on a personal bent, I was in the military, and trying to do something after the fact is very, very difficult.
Yes.
But when I got to the States here, and I asked for the records from the nursing home, that it was kind of like difficult to get, and took me a while, and I finally, and then trying to get an attorney and whatever, and it's difficult after the fact. So something like this here is very, very, very important. And there's only two vulnerable populations. It's the very young and the very old. And just thank God for organizations like yours looking out, because this is a real situation. And the fact that the coroners are backing this here just lets you know just how vitally important something like this is here. And I would just ask my viewing audience just to and Kathy, let me ask you a question. Right now, can you give the contact information, Georgia Council on Aging and COAGE, if you can give our viewing audience, because I know there's going to be a lot of people going to have a lot of questions, and they really need to be able to call and find out and get the answers they want.
Sure. So our website, www.gcoa.org, and you can find everything you want. You can find out how to sign up for Senior Week tomorrow. On Facebook, since you're already on Facebook Live, we're Georgia COA. Georgia COA is our page, and you can go on there and find us, and you can send us a message right now. You can sign up. We also have a phone number, 404-657-5343. If you want to leave us a message, we are working virtually, of course, but we get those messages off daily. We'd love to hear from folks.
I'm hearing from John R. Fox, who happens to be my nephew in Sacramento, California. And he says, so Georgia has laws. I'm trying to read this, by the way. Georgia has laws protecting the elderly. He has a question mark. That was his question. And
we have some very good elder abuse laws in Georgia, but the need to just double check when a senior passes away in a nursing home is something that we've identified as needing some changes. But we do have, I have to say that I'm very proud in the last 10 years of the laws that Georgia has passed on fighting elder abuse. We've actually, some of our leaders have gone around the country talking about some of the things that Georgia has done. An unlicensed personal care home is a misdemeanor, and if there's any evidence of abuse, it's a felony. Right. And that is not true for most other states. That is a big improvement. We've had a number of improvements in our elder abuse statute, and it's allowing our prosecutors to actually put people that abuse seniors in jail,
Great.
which is
That's
where they need to
great.
be.
That is great. And the first issue with the behavioral health, I'd like for Susan and for Dr. Pitts, if they have comments, and Eric as well, because you want to know something, the manifestation of it, it alarms people, and they don't know, they can't, if they're not a diagnostician, clinician, to know that aberrant behavior can be caused by a problem. A lot of times they end up putting the senior out, or it leads to abuse. And so this is really, really, really significant. Susan, would you have a comment? Or
I was wondering why specifically Tifton and Albany? Are there higher rates in those areas?
It had to do with, we did see a definite need. What we're really trying to do with this is prevent evictions. And we saw, people at risk for eviction. Because if you've got folks in a HUD facility, if they get evicted, they are at real risk for homelessness.
Yes.
And so this has been in existence in Atlanta for, I think, about 3 years. They have some coaches that are working with Atlanta Public Housing, and their success rate, they are at 99% success in avoiding evictions.
Wow.
And so what we're looking at is, can we take this service model to more rural Georgia?
Oh, yes.
And so that's what we started with. And we looked at where do we have an area agency on aging already with a good, a good relationship with senior high-rise, Section 202 housing. And we also had to have enough of a volume to make the expense worth it. So we needed to have at least 500 residents in a geographic area, to make the the expenditure work. So we putting all of those factors together. Now we are also looking at some other parts of the state. But you know how working with legislators, you put a lot of bait out on your hook.
That's right.
And, you go where the wiggle is. And we got a wiggle for Tifton and Albany. And that's what we're reeling in as fast as we can. So.
And that's why you're the executive director. You know how to get it done. Dr. Pitts, do you have a comment?
I do not. I apologize for having to step away, but I'm sure I will have some later on. But thank you.
Dr. Pitts is a good daughter, taking care of her mother and father. There are other issues. I noticed also there's disaster planning.
Disaster planning. And so this really, when the pandemic started, there was a recognition, of course, hospitals need PPE, but and then people did think about, nursing homes, but then there's kind of a mindset of, okay, seniors are either at home or in the nursing home. And so it took a lot of work to get policymakers to understand we've got a whole range of providers for long-term care services and supports. We've got a need in assisted living, we've got a need in personal care homes, we've got a need with home care. That our occupancy in nursing homes is way down over a year ago. A, because we've lost folks, and B, if people cannot go, families are keeping them out. They're taking them out, they're keeping them out. And what happens with those folks? They need home care. So if somebody comes into your home, they need that protection. They need PPE.
Exactly.
And so we really have been educating, working with, talking with the leadership in Georgia about the recognition that there's a whole range of services in the long-term care continuum. And we really have, gotten good results. We did see the recognition that for vaccine, the 1A vaccine covers area agencies on aging's direct care workers and their providers that are direct care workers. They are in that 1A vaccine category, which has been fabulous, getting that recognition. So we are planning to introduce a urging resolution in the House of Representatives, which is just bringing more attention. We've gotten lots of good feedback from leadership about this, and we're bringing more attention to each part of this, the protective gear, the testing, and now the vaccines. Recognition there's a whole range of providers that need to be considered.
And that's extreme, and that is what you're verbalizing, Kathy, is extremely important, because everyone knows just how serious this virus is, and everyone, but a lot of people don't understand what you just got finished explaining, and unless you're involved, it is, you don't know. But there are a number of individuals who have their parents at home that need healthcare providers coming in, and those healthcare providers need to be protected as well. And there is
and then the last one is telehealth for dentistry. And we worked with the dental hygienist a few years ago to allow dental hygienists to come in safety net settings, and for us, that's nursing homes, to provide cleanings without the dentist being in the building, because of course that raises your cost when you have to have the dentist along. And so that did pass. That has been a good addition. But what they're looking at now is if they could be connected by a camera. So the dentist is back in the office, the hygienist is in a safety net setting, and they could have a camera hook up and communicate with the dentist about what the situation is with the patient. And we are, the hygienist and the dental association are still working on language to come together to make this a reality. We've all seen telehealth expand greatly during the pandemic, and we'd like to carry that over into dentistry too. And so we are waiting for them to get together on language, and then we're going to support legislation to make that happen.
And Kathy, that was a huge, with a capital H, capital U, capital G, capital E achievement when we were able to when y'all were able to pass the dental hygiene that's going into the home. That was huge, because as a lot of people can attest to, and I know right now Dr. Pitts can say, that the bottom line is go ahead, Dr. Pitts. No, the primary,
I can hear you.
A lot of people don't correlate dental care to your overall health. And for a lot of seniors, that was being neglected. And so that was huge to have that pass, Kathy.
Yeah, this really educated me, that whole process, with how vital the health of your teeth to the rest of your body. It's very important.
Right. Well, Kathy, we've covered all the bases here, but I cannot wait to get you to come back on the 19th. I'm excited about it. And please, before you leave, will you give all your contact information again, how individuals who are hearing this program, all this good information that you're giving out, how you can, how they can contact and get more information from the Georgia Council on Aging and Co-Age.
Definitely. Thank you, Pops. We are on Facebook, have a very active Facebook page. We'll be Facebook Live tomorrow at 10, Tuesday. And that's Georgia COA, Georgia Council on Aging. We also have very active website. And those of you that are not so prevalent on Facebook Live, you can watch our program on our website, www.gcoa.org. of2.org tomorrow. You can also reach us at 404-657-5343, and look forward to y'all's questions in the chat tomorrow. Thank you, Pop, so much for this opportunity.
Can't wait till
Appreciate it.
so I can tune in and hear all this good news. Thank you so much, Kathy, for taking the time and coming on there.
Thank you. Thank
See
you.
ya.
Good to see you, Eric.
And now, our Facebook, what do we have? Eric, Mr. Eric Jacobson. Eric, we are so excited having you on as well. And you did a very awesome, with a capital A, presentation. And I'd like for you to talk about the Georgia Council on Developmental Disabilities and anything else that you want to start with. You can just say, let them know who you are. You're the executive director.
Well, Pops, first of all, thanks for having me here. I'm Eric Jacobson. I'm the executive director of the Georgia Council on Developmental Disabilities. And, you know, it's really an honor for me to follow Kathy Floyd. Really, the Council on Aging and the Council on Developmental Disabilities are very well connected because so many of the issues are similar for people with developmental disabilities and for older adults.
Right.
So some of the same conversations are the conversations that we're having. And is this the time you'd like me to share my screen and kind of talk about what the council does? Let me see if I do this all right. And I think I've got it all figured out. Let's see. There we go.
There we go.
Is that it? Okay, great. Well, again, I'm so excited to be here and to have this conversation with you. And I'm going to run through these slides really quickly, and then we can have a conversation if that works for you.
For me.
Okay. So I just want to tell you a little bit about who we are and kind of where we come from. Like the Council on Aging, we're actually created by federal legislation as well as state legislation. So for us, the Developmental Disabilities Bill of Rights and Assistance Act actually goes back to we can actually trace it back to John F. Kennedy administration, and it emerged in kind of its current form in 1971. So we've actually been around for quite a bit of time. And our role really within that is to engage in capacity building and advocacy so that we create systemic change. And that our role really is to make sure that individuals with developmental disabilities are independent, although I would suggest to you that nobody's independent, we're all interdependent, that we're productive or we have economic self-sufficiency, independent and integrated in our communities, and self-determined in our lives. So we see those as the outcomes that we're always working towards for folks with developmental disabilities. And that a lot of that, the way we look at things is, if you're thinking about any of us, again, whether we have developmental disabilities, we're older adults, we are regular citizens, that we all want to have opportunities for a job, for a place to live that we can call our own, to have opportunities for learning, to have influence over our lives. And then for folks with disabilities, it's about also having the supports necessary. Our composition of our board is determined again by that federal legislation, and it actually says that 60% of our members, who are appointed by the governor, must be individuals with developmental disabilities and family members. And we can even break it down further into a third, and then a third of a combination. So out of those 60%, we're really trying to focus on bringing people with developmental disabilities and their families to the table, and they get to then have the conversation with the agencies that are listed below on the screen. Anybody. So what the federal legislation does is it dictates that any state agency that receives federal dollars that might impact people with disabilities should be on the council at the same time. So Rehab Act is the Georgia Vocational Rehabilitation Agency. IDEA is the State Department of Education Special Ed Department. you can see right there that we have a representative from the Older Americans Act, from the Department of Human Services. Title V is Medicaid program, and Title 19 is maternal and child health. And then protection advocacy, like Kathy was talking about earlier, we have an issue of abuse and neglect also in the disability community. And as a part of this Developmental Disabilities Bill of Rights and Assistance Act, it created a protection system that actually allows, in the state of Georgia, it's the Georgia Advocacy Office, to go into nursing facilities and institutions and actually investigate possibilities of abuse, neglect, and death. And then the Centers for Excellence in Developmental Disabilities is kind of the research arm of what we do. And in fact, that's just what the disability, what we call the Developmental Disability Network, which are the university centers, the DD councils, and the protection advocacy agencies. And you can see who they are across the state. And I went over this just a second ago, but the important part of this next screen is really to look at the map on what would be my right-hand side. And that really kind of shows where our projects are and what we're trying to accomplish across the state. And you can see this map in a more detailed view on our website at gcdd.org. And it really shows that idea that what we're trying to do is make sure people have opportunities for homes, a place to live, a place that they can actually call their own, that they have the key to, or the lease, or the mortgage, to have a job, a real job, and to be able to, I know it's been more difficult during COVID, but to go out and earn a living. Again, to go to school where you want to go to school, with your neighbors, with your friends, and then to have support and influence over your lives. So I think that probably one of the most important things that we can talk about this morning is, where do people with disabilities access supports? And it's not going to be a lot different than what we talked about with Kathy just a few minutes ago. So for people with developmental disabilities, we have 2 Medicaid waiver programs that support individuals. One is for folks that need less intensive supports. That's called the NOW waiver. And so that's somebody who maybe is living in their parents' home, who needs the direct support staff to come in and help them out, or maybe needs help in going to work, but doesn't need kind of that intensive residential support. That would be in the comp waiver. And that really provides opportunities for people to live in group homes and other kinds of residential places. And both of these are really important in making sure that individuals get the supports they need to stay out of nursing facilities. Or for people with developmental disabilities, we operate one state hospital in Gracewood in Augusta that is just for people with developmental disabilities and people that have behavioral health issues, as well as other kinds of hospital facilities that take in people with developmental disabilities. We're trying to, like the Council on Aging, we're trying to keep people out of those kinds of settings and instead receiving a home and community-based services. And like Kathy was talking about earlier, we have 7,000 people deemed eligible. These are 7,000 people with developmental disabilities deemed eligible on the waiting list to receive that NOW and comp waiver. And we can go back about 15 years, and there were about that many people on the waiting list then. And in fact, when we started the waiting list campaign, it was a campaign in collaboration with Council on Aging, people that suffer from significant mental illness, and people with physical disabilities. So the 4 organizations, the 4 kind of advocacy groups came together to make legislators aware of the fact that we had people on the waiting list for home and community-based services. And this is another way of seeing those issues in terms of waiting lists. I mean, all we're doing right now is putting in about enough money in the budget for the legislature to serve about 100 additional people per year. If we do that and we continue to do that, Pops, you and I will be gone, our grandchildren will be gone, and we'll still have a waiting list for home and community-based services. So we're not making any impact doing that at all. And this is for me, this is about priority, and this is about the legislature. The legislature needs to step up, and the governor needs to step up and say, hey, listen, we want to make a significant impact on the waiting list. We want to bring it down from 7,000 people significantly. I mean, you can see from this map that in 2014, we essentially had the same number of people on the waiting list that we have today. So we've made no progress at all.
Mr. Jacobson, this is Susan. Relatively compared to other states, how is Georgia's number on the waiting list? I mean, are we one of the worst for now comp waivers? How do we stack up against other states?
We are near the bottom of other states, but I have to tell you that there are 400,000 people across the country that are on waiting lists for home and community-based services for people that have developmental disabilities. 400,000 across the country. So this is not just a problem of Georgia. This is a problem across the country. And however, there are some states that don't have any waiting list now, and that's because either their governor stepped up and said, we're going to address this and we're going to do a significant job, or they put things into their system that that address those barriers and obstacles that keep people in services and get more people in services. Things like Medicaid managed care for long-term care services has been one way that some states have looked to address the waiting list on a regular basis. But we're near the bottom, and that's not unusual for us when we think about home and community-based services for all the populations that we're talking about today. Georgia tends to be one of those states that puts less money into our budgets than other states. And then we use the fact that we didn't spend as much on the quality of life for people to say that we're a great business state. So I tend to think that there's some problems there if the quality of life for the people that live here is not on par with the fact that we're trying to bring new businesses in.
Hey Eric, if I can just have you stop here, because you're hitting some really crucial points here, and,
Sure.
and what I would like for you to do, because it's Eric, it's all about informing the community and really prompting the community to know what the reality of situations are, and if you could now at this time just let our viewing audience know how they can contact you if they want any further information or to go in further detail about what you're talking about. Can you please give your contact information, your brick and mortar, your email, your phone information that they can contact you? Right now, I think it's an appropriate time to do that.
Yeah, let me just kind of bring that up right there. So again, my name is Eric Jacobson. There's my email address, eric.jacobson@gcdd.ga.gov. Our website is www.gcdd.org. You can see that similarity then to Council on Aging. You can see at the bottom of this page how you can reach us through some of the other social media contacts. And then finally,
it's not coming up as clearly as we would like to see it.
We can see it, Pops.
Okay.
See it?
Yeah, I can see it.
Okay.
Yeah.
And you guys,
It's not coming up for me, but that's fine.
because I can't see you. I can just see the screen right now. So
That's no
and then
problem.
finally,
If we're covering, I'm going to want you to come
Good.
back, because this is important. I mean, this is important, and it's important for. I know repetition. There's a Latin expression, repetitio ex mater studiarum, means that repetition is the mother of study, and I'm a firm believer. And the more that you let people know, and the more you repeat something, it starts to really sink in, and people motivate and get involved. So we're going to schedule you to come back, because there are some things that you need to really get in depth in. to let people, because this is serious, because it's dealing with people's and their lives and their well-being. And as we spoke prior to the onset of the program, the only way that it happens when people get involved and let their state legislators know this is what we're concerned about, and then you represent us, so this is what we want you to be concerned about. And this, what you said to me was a wake-up call. I mean, it was really, and even though I know, but the numbers speak for themselves. The numbers speak for themselves. Nothing like statistics. Nothing like statistics. And so we're going to actually have you come on, because you hit some points that I'd like for you to come back and just reemphasize again.
Can I just talk about one other thing related to this? And I think that
sure,
it's important for viewers to know. So we actually just produced a short film. It's called 6,000 Waiting. And this is a short film talking about 3 people who have been on the waiting list and are on the waiting list, and their lives and what their lives mean with and without a waiver, and without that Medicaid support. And 3 men, 3 young to me, right? Because I don't have gray in their beard like I do, and like you do. But 3 men from across the state. One is in North Georgia, one is in Athens, and one was in Augusta. And these 3 men have struggled to get the services and supports they need. And what does it mean to them if they don't have those? Well, one of them is still residing in a nursing facility. And we actually have a campaign. This is a campaign to get him out. So when Kathy was talking about nursing facilities and older people living in nursing facilities, we still have a significant number of people with developmental disabilities that are under the age of 65, way younger, in their 20s, in their 30s, in their teens,
yes,
residing in nursing facilities that shouldn't be there. And
right.
Nick Papadopoulos is one of those guys. He's featured in the movie. And actually, if you go to 6000waiting.org, we have a campaign to try to get Nick out of that nursing facility. So this is an issue, again, that addresses not only older adults, but younger people with disabilities, because we don't provide the supports necessary for families. You talked earlier about caregivers. We had those same issues. We have those same issues during COVID in terms of caregivers coming into people's houses, and whether they have PPEs or they've been exposed to the virus or whatever. Those same kinds of things emerge for people with developmental disabilities as well.
This is awesome. Could you tell our viewers how they can access that film again?
Yeah, go to 6000waiting.org. And you can't actually watch the movie. Right now they're trying to create some organized watching around it, so that, and in fact, when we premiered it a couple of weeks ago, we had people from around the world that were watching that at the same time. And so if you go to if you go to 6000waiting.org, it will tell you how to sign up to actually view the film. And I personally have found it moving and touching and very informative at the same time, and humorous. I mean, to think about the fact that you can have humor when you're talking about a waiting list in people's lives. But I think there are some places in that where it made me chuckle just a little bit in terms of personality and how people persevere at the same time.
Right. The trailer is out there on your website, and I watched the trailer, and that alone was really inspiring. I think the trailer is maybe 3 minutes long, and gives little snippets of each of the individuals that they're highlighting, and it goes everywhere from, all 3 of the gentlemen have cerebral palsy, but they're living at with different abilities within that diagnosis.
And Eric, something like that is very impactful. Having a film is very impactful. And what we might want to do now, you know, I'm very, very, very challenged when it comes to technology. But what Susan said is very apropos. If there's any way, because you want to know something, we had a half an hour, Susan, if we could ever have Eric come back on, just to talk about and run that. Because when you get on the inside of individuals' lives and see what they have to cope with on a daily basis, I am a huge believer in the kindness and empathy of human nature. I'm not
Well,
Jake.
one of the main reasons we wanted to have Mr. Jacobson on is that March is Developmental Disabilities Awareness Month. And we wanted to talk a little bit about the inclusion revolution and including people of all different abilities in
Right.
in life, in society, to make sure
Right.
that everybody is represented.
Yeah, you know, one of the things that we talk about quite often is this kind of, and I know this has gotten a bad rep as a word, but this kind of intersectionality piece. And when you think about people with developmental disabilities, they're people of color. They are, doesn't matter what sexual orientation you have, doesn't matter what political party you have, you affiliate with, it doesn't matter what religion you believe in. It is, for us at least, kind of one of those central parts of the radius of a circle, right? That's kind of that spoke piece. And because you have developmental disability, and then you are part of all these other groups as well. So we really see this as an opportunity to bring everybody into the circle, right? To have that conversation that says, look, when we talk about developmental disabilities, we talk about people's abilities to, I mean, and everybody has, and this is what all of our religions have taught us, everybody has gifts and talents that they can offer and that they can share with others. And that's that's our message, is that people with developmental disabilities have gifts and talents just like everybody else, and have those, and they should have the same opportunity as everyone else to share those gifts and talents with the community in which they live in. And Pops, you're creating an amazing community just by the work that you're doing here. And so when you think about expanding that community and really including all the people that make up your connections, then that's what we're talking about when we say everybody gets the opportunity to share their gifts and talents.
And you know, in the list that you sent, that I saw when it said it mentioned home, the one that jumped out besides home was career.
Yep.
Everyone needs to feel I'm contributing. This is a part of human nature. I have a career. I'm doing things, and as Susan and you mentioned, it's very vital. But you talked about the intersectionality of things, the inclusion. That is extremely, extremely important. And this is so meaty. There's so many layers of this here. That's why you've got to come back and for us to peel like an onion, because it's exciting to me right now. I know it has to be exciting to you, to Susan, and to Dr. Pitts, because when you inform people and you're sharing information that you want them to have, and you have the ability to do it like we're doing now. And I have learned from you, I mean, things that I know, but you've made it real to me more by your presentation and by us discussing it. Discussing it now in this forum allows other people to understand and to feel what their emotion like we're feeling as well. And so we need to plan. I would love to run that on this show, just so people can, as Susan said, she saw the trailer and how moved she was. We need to let people feel, because we're all beings that have emotion, and this is awesome.
Well, I know that, Pops, like you have your executive producer online with you. I think my executive producer is online as well. Hillary Hibben is in the chat box. And so I'll make sure that when we get off, Hillary and I get together and we figure out a way to show this on your show. I think it's really important that folks that are watching you see it as well. And so we'll work on that. And I did want to mention as well that we have a really important project in the Columbus area. And so amongst others, but the one I wanted to mention was that one of the things we've been promoting, and you talk about inclusion, is inclusive post-secondary education. So for parents who, when they got their kid's diagnosis of developmental disability, said, oh my God, you know, my kid is not going to grow up like their other siblings, or they're not going to grow up like other kids that I know, and they're not going to go to college. And so families didn't prepare for their kids with developmental disabilities to go to college. Now we have 9 programs around the state around inclusive post-secondary education. One of them is in Columbus at Columbus State University. I want to give a shout out to Greg Blaylock and the folks over at Columbus State who are doing a fantastic job of trying to find ways to make sure that kids that, first of all, did not get a regular education diploma. Most of these are kids that got special education certificates, which are not worth the sheet of paper that they're printed on for the most part. It doesn't allow them to go to a normal college or regular college program. It often doesn't allow them to join the military. It often doesn't allow them to get a job. So we have created these programs around the state to make sure that kids do have the, first of all, have the college experience that we all, many of us had, and that experience is just as important as the education that we get. Right?
Yes.
You know, to hang with other kids our age, to be away. One of the first times I ever really had a conversation with a student that went through one of these programs, he talked about the fact that this was the first time he had been away from his parents and that he got that freedom to interact. And he knew that his responsibility to make sure he got up in the morning and went to class, right? Before mama and daddy made sure he got up in the morning, the teachers made sure he did all of his work. They don't do that in college. You know, it's kind of you're on your own. So you have to learn that responsibility. So we're really proud of that program, and we're really proud of the program at Columbus State. That's how we create inclusion as well. We get kids that are on campuses, they interact with other folks, and all of a sudden you created, again, a community where all people are involved.
Exactly. You want to know something? You're blowing my mind right now because I didn't, and it was this Greg Blaylock. I didn't, you want to know something? This is something I didn't even know about here. And you're blowing my mind right now because this is awesome. Awesome, Eric. This is awesome. And this topic is so meaty. Susan, we're going to have to, and Susan is the executive producer. She keeps me in line. Possibly we need to do this and we need to include this in and this and whatever. We need to.
Somebody to keep us in line.
There you go. There you go. That's it. That's it. And she does that too. Well, you know what we're going to need to do? We're going to need to, because I mean, this is what you mentioned just now. There's so many different, like I said, onion layers. Just what you mentioned about CSU and Mr. Blaylock and what's going on. This is something I didn't know. How many other people? And I'm embedded in the community. I'm out in the community, and I didn't know about it. That's why it is so important to let people know. And I am excited. So we're going to have to, Susan.
Yes, sir.
I'm going to throw that ball because I do know you know how to dribble all around and around here between the legs and still do a three-pointer. And I know you can dunk it because I've seen you dunk the ball. So the bottom line is the fact that you got the ball on this here where we can actually go into all the different segments of what Eric's talking about. And Eric, I do want you, and I don't know this, Mr. Blaylock. And what is Mr. Blaylock's title?
He's a professor at Columbus State University. So I mean, my guess is he's a doctor, Dr. Greg Blaylock, right? Because he's a professor.
Yeah, the name sounds familiar to me.
He actually has a child with developmental disabilities. So he and his wife are both very active in the disability community. And again, Greg is a great guy in terms of just talking to him as well.
Oh, look,
You
want to know something? I'm just excited about everything that but this really has blown me out of the water. And you want to know something? It is about inclusion. You know, it's about inclusion.
Can I share a story with you? I have I volunteer with Girl Scouts, and I worked with a young Girl Scout who was on an IEP in the Muskogee County School District to help her get her Gold Award. And she's now attending college at Fort Valley University in their program for children. Yeah.
That's awesome.
So, and her mother had a little hard time with her going away to school, you know. She was all into it and so proud to be independent, but mom had a little hard time with it. But it's a great program.
Isn't that true for all of us when our kids go away to college? You know, especially the first one or maybe the second one. where we're like all teary-eyed and oh my God, how are we gonna
I've been there. Yeah.
survive,
Yes.
right? Not them. How are we gonna survive as parents? And then the kids go and they're like, oh my God, this is life.
Right. No, no,
This
no.
is what I want.
And you can see the change in the maturation in them. You can see it. And you want to know something? You're right, Eric. It is about inclusion. And you know, everything that you've been saying, I know is touching the emotions of all of our viewers. And it's good for them to see individuals who are involved in doing work just for the sake of doing it and creating an even level playing field for everyone, a level playing field. I see Dr. Pitts has a comment.
Right.
Yeah, I'm sorry if you,
Yes.
can you hear me okay?
Yes.
Yes.
So, this is really good to hear, just as far as the program itself, the inclusion program, and how you're allowing these students to get an education, but also have work experience. And I can say for myself, I've gone to the grocery store, specifically the Publix on Macon Road, and have met some students. I'm pretty sure, I think that they are some people who are involved in this program, and it affects everyone. And so just someone helping to bag your groceries, to help take them out. And I like to ask, okay, what are you doing? And sometimes they'll say, oh, I'm a student at CSU. And, being someone who's trained in certain areas, there are certain things that I can pick up on, or even just, ask, or sometimes they will say, and I'm like, you know what? It's wonderful that you can feel out of touch, but for someone who can affect your day-to-day life, something as simple as going to the grocery store, but you have a student here who has not only is getting an opportunity to have their education expanded by being on a college campus, as we were just speaking of, but also getting work experience. And you talk with them, and these are students who can do things. They can, and as long as they're given an opportunity, then why not? And so to hear Eric speak about the program, and to say that I have come in contact with some of those students, I'm sure it's good to hear. It really is. And so it just speaks to the importance also of not keeping people out, but including them, allowing them to be part of the community. Because guess what? You're going to want your groceries to be packaged correctly, and you're going to want them put in your car correctly. And these are students who are these are things that they can do. But unless it is a priority to the folks in charge at our state capitol, then, I think, well, I'll put it like this: we have to make it more of a priority. When the people at the top are able to see how, well, you know what, this is how I'm directly affected by it, and it's
Exactly.
you're not excluding anyone. And so it's really important to hear you speak about that. And I can say for myself that I've come in contact with some students who are benefiting from those programs. So thank you for enlightening me, because I didn't know.
Thank you. And again, I go back to, at least for me, I can't speak for anybody else, but I know that when I went away to college, my parents had the expectation there was a job at the end, right? That it was all about, you didn't go to college just to twiddle your thumbs. You went to college because in the end, it resulted in a career, in work, in something that you had passion about to do that. And I think that's the other piece to this, is that when kids go to or involved in the inclusive post-secondary education program, they come out with skills at the end. They identify kind of what their passion is, and then work towards those skills so that when they do get out, they have opportunities for work. And in fact, on March the 10th, like Kathy was talking about earlier with their Facebook Live date tomorrow, we have an advocacy day that's focused on employment on March the 10th. And of course, it too will be virtual, because none of us can go into the Capitol now, and I'm not sure any of us want to go into the Capitol right now. But it will be virtual, and we're using the Zoom platform as opposed to Facebook Live, but it's the same kind of idea. We want people to come and learn and talk with legislators, or hear from legislators about why it's important for people with disabilities to go to work. And we've been working very hard to try to increase those opportunities for young people and other people with disabilities to get a job and to have a career, because again, that's what we all strive for in our adult ages, right? So we're just trying to.
Now, Eric, for someone like me, who's computer challenged, extremely computer challenged.
Listen on the phone.
How would I? It's a Zoom meeting.
Yeah. So
how would and I had somebody say, "Pops, when it comes to you Zoom, you think Jackie Gleason Zoom." But
hey, listen,
how would someone like me
remember who Jackie Gleason was?
Yeah.
Right?
What do you say? Zoom. But
the moon, Alice, right? The moon.
There you go. That's it. That's what I said. It's good to know someone can identify with what I'm talking about. Now, Eric, how would I be able to? Someone would be able to access this here on March the 10th.
So first of all, you can go to our website, www.gcdd.org, and it will give you information about the Advocacy Day. But you can also access the Zoom by telephone, by listening in, as opposed to having the video picture that we have today. And if you go and you register for the event, it will give you the telephone numbers to call in as well. So you don't have to use it.
Give me the telephone. That I can do that real easy. I'll get that. I can dial those numbers now. I can do that. There is just so. Were you going to say something, Kathy? I mean, Susan. There's just so much that we have got to, Susan. There's so many different aspects that I definitely want us to do something. And we're booked out, I know, until June, but everything is tentative. So I want to get together with you and to shift things around somewhat. I know we got Kathy coming on, but I would like to get Eric. And Eric, you want to know something? If you wanted to reach out to, or I can try to reach out to Dr. Blaylock. This is an area for us to pursue. I did not know about this at all. I did not know, and you've just informed me. My adrenaline's pumping. I'm so excited. And there was, I do want to, the only pure science is mathematics. For you to say that you'll be going, I'll be going, I know I'm going to be going before you. I'll be going, you'll be going, and the numbers will still be the same. It's staggering to me.
Yep.
And my military training just teaches me to, and I mentioned it to, I learned very easily when I was a young sergeant, to plan effectively and completely, but implement immediately. And so even though we might be talking long range, I would like to, when we do the programs, to speak about what it's going to take. And I would like to, you said that there are some states that don't have such a backlog. Well, we need to know what states they are and maybe find out what they're doing, give it to our viewing audience, and our viewing audience carry the ball and start calling their state legislators. That's the fix. The military told me there is no problem that can't be solved, Sergeant, so you make it happen. And so the bottom line is the fact that we need to be about making it happen. So if you can get with my executive producer, the lady with the glasses, Miss Susan Gallagher, and we can reach out to Dr. Blaylock, doing a marvelous thing at I went to school, got my nursing degree at CSU, fantastic school. Then we can start peeling away a lot of the layers that a lot of individuals like myself, you educated me tremendously. I'm in link with Kathy because I've known Kathy so, but it's been my pleasure. Hey, you're my new BFF.
Great. You're my new BFF.
So we can start thinking how we can, it's all about remedying a situation. And so if we can, Susan, if we can maybe meet afterwards or whatever and do this. And Dr. Pitts.
Yeah, I'm open to whenever you are, Pops. So you just let me know.
Well, let me tell you something. You've been a blessing, not only to me, but to a lot of our viewers as well, who, like myself, did not know all that's involved. I know people with disability have been involved, but you open up some areas in my eyes that we really need to peel away and inform more of the people.
And I've done my job.
And so we will do this, and we can try to work out that film, because I think that I saw the expression on Susan's face when she said she saw the trailer.
Yeah.
She said, I saw the trailer, and I saw some feeling in that bad boy when she said it. So you got to appeal to the people to let them really know, because this is a very, very, one thing I spent 20 years of my life in an organization, because my grandmother told me, and she said, you all are going to find out this is the best country on the face of the earth, and it is. And I spent 20 years of my life because I love this country, and I know the people in this country. And people, when they know that there's a need. And I came back to Columbus from the Pacific Northwest, fantastic in Pacific Northwest. People are great. But I always tell people I came back down south because Southern people are folks, F-O-L-K-S. Not saying anything about the people, you got folks out there too, but I just love the South. And so you got me excited. You want to know something? I am so excited. I've got to calm myself down here and hold on to the sides of my kitchen table to keep up, jumping up and shouting or something. I'm so excited about the possibilities of learning more, but at the same time, us peeling away the onion to try to come up with the solution. So we will, Susan, you and I will talk schedule.
Yes,
about
sir.
it, and we've got about another 5 minutes to go. We're going a little bit over, but this is, you want to know something? This is so good. It's just awesome. If there's anything else
that in the movie, I think you'll appreciate after what you just said. Nick, the young man who's still residing in a nursing home, who comes from New York, talks about kind of coming to the South and how that good neighbor feeling comes out when you come to the South, as opposed to being in places like New York City. And I think he'll piggyback right off of what you said.
Walk. The first time he came to visit us, he got lost. He said, I could not believe, he says, a lady that was on the highway, I stopped at the gas station. He went 2 stops past us, saw me, and I went to go ask a question. Not only did she tell me, but she said, follow me, and brought me right to your door. He said, now I understand what they talk about when they say Southern hospitality. A woman never knew me. I could have been anybody, but she took the time. I met her at the gas. That's Southern hospitality. And so what we're going to need to do, I want you to give all your contact information again off the top of your head. And then you cannot get away.
I'm not leaving.
Have you come back.
I'm not leaving. I'm not leaving. So again, contact information, Eric Jacobson. My email address is eric, E-R-I-C, jacobson@gcdd.ga.gov. Our telephone number, again, nobody's in the office right now, but we'll return your phone call, 404-657-2126. And our website is www.gcdd.org. And you can find us all over all the other social media sites that are out there. So, so we appreciate, we want you to call us. We want you to we want you to tell us about what your issues are that you're dealing with. And Pops, I really, really appreciate you all having us on today.
No. You've been
I'm looking in the chat window right now. Your executive producer, Hillary Hibben, has been putting a lot of things out here. The goals program at Columbus State University. She gave the contact information for Gregory Blaylock. She has the link for the advocacy days and your homepage out there. So Hillary's been updating stuff. I don't know if you can see it pop in the chat area, but Hillary's been placing a bunch of stuff out there. She's excellent.
I've been looking, I've been wondering who's been doing it. You dumb me. I figured these are advertisements on the side. I've been seeing them pop up.
None of this exists without a great executive producer.
That's it. The lady with the glasses.
That's right.
No, how they say? No, this way he said, Muhammad Ali. She's the greatest of all time. So listen, any last comments, Susan?
No, just thank you so much, sir, for being here. And I hope that we have a great IDD Awareness Month and bring more focus on the lives of individuals living with developmental disabilities. A lot of times they're an unheard population. people with developmental disabilities have a hard time voting, have a hard time being heard by politicians. So it's up to us to be the voice for these members of our community and to be striving for equity, not equality.
And that's exactly.
Yes.
Let me tell you something, Eric. If you could send to Susan, I always like when I send the programs out to have a paragraph. Now I do what I'm told. Before, when I go to I forget what it is I do. I just do certain things, and the film comes up, and I can hit news feed, and I can hit publish for my page. But I like to have a little paragraph above what I said. If you could send that to Susan for me, that would kind of encapsulate what this is all about. Dr. Pitts, you have a comment?
No, just thank you again for coming, Eric. And I just repeat what Susan said, but again, unless it's a priority for everyone in general, and you see how you're directly affected by these individuals, then if you don't see it as a priority, then nothing will be done. And I was struck by the comment you made earlier about things will remain the same after, decades go by. That's a shame. And so I think that, again, unless it's a priority for those at the top, and unless they see how they are directly impacted by individuals who can contribute, then that's why those statistics are what they are. So thank you again for being on the show and for the information that I've been able to gain from it.
And Susan, I'm looking at it now, and that dumb self that it's been popping up. I figured it was just some of the, what do they call that, spam or whatever they call. And Hillary, your executive producer, she's definitely on it. Is there any way we can, we'll talk later because you got it. We can get this to run, and I can get this to run, all this information. We'll get together and talk. I don't want to take up too much more time. Boy, Eric, you're my new BFF. Don't you remember that? So, you ain't going away nowhere. We're going to close out. And as I always say, this has been awesome, Facebook family. This has really been awesome. God is just so, God is light years ahead of us. And I'm just so grateful that the good Lord just loves us so much to be light years ahead and makes things available and comments and link people up and whatever. It's just awesome how much the Lord loves us. And so, as I always say at the close of each and every program, and this is very important, to please be good and kind to yourself because God loves you. God bless you now. Bye-bye.
Bye.
Bye, everybody. Thank you.